My name is Dr. Bryan Ludwig. I'm happy to represent the New York Chiropractic Council today. Senator DeFrancisco, you asked what if we were to scrap the whole system, what we would do. And I think you've come back to that a few times. So throughout my testimony today, the next 5-6 minutes, perhaps we'll get some ideas with that. Just to lay a small groundwork to that, I think higher level cost healthcare items tend to come when people are less healthy. So it tends to cost less to keep them healthy in the first place. And some of that I was trying to put in my testimony when I spoke before the proposed New York State workers' compensation fee changes just a couple months ago. But I want to say thank you to the legislature for making September 2015 Chiropractic Health Month. That's very important to us. We have a lot to explain. There's a lot of myths about what chiropractors do. We try to let people know that health comes from within, that we all have the inherent ability to heal, that our neuroimmune systems control this, and that's what I work with as a chiropractor. I don't crack backs. I don't work on pain. I don't say, hey, here's my pain, work on this right there. You know, that's not what we do. It's a nice side effect. You feel better. Enough of that. So the last couple of years I testified before you, and I hear a lot about the treatment of disease, which I don't do, but it costs a lot of money. And then I'm hearing Dr. Zucker from the New York State Health Department say, hey, we got a lot of data collected. We haven't been willing to change the dynamic. David Rich of the Greater New York Hospital Association. Care needs to be provided so that people don't get sick enough so that they need to go to the hospital. Some common themes here that are finally starting to come together. Well, as a chiropractor, there's starting to be evidence that what we do allows people to be healthy. Now, I've known that for a long time. When I adjust a child, it's not for pain. Maybe they had ear infections and they no longer have them. Did I treat the infections? No, I did not. But I also see the same trend when I do health history on somebody, an adult, say, and I'll go all the way back to their childhood. I'll say, hey, what was their birth history like? Well, boy, they really had to pull on my neck. Then I had ear infections. Then I had asthma. Then I had headaches. All this stuff cost more and more as their health degenerated more and more. So as you look through, you'll see some studies I would be happy to have you look at, but I'm not going to read them. They talk about how the longer somebody's under care, not only do they feel better, their health improves. So, for instance, it talks about hospital admissions decreased by over 60% when this one insurance company over 7 years used chiropractic care as a gatekeeper. So the longer they used it, the less they were in the hospital. You might say, well, boy, there's going to be a problem with that. Hospitals will go out of business. Well, maybe the same thing that happened in agriculture in Schoharie County, where I live and where I work, is a lot of the farms that only did dairy started to have problems. They had to diversify. They had to do other things, raise grass-fed beef, things like that. Well, maybe they should start to get reimbursed, say, the respiratory therapist in the hospital, instead of just for administering the medication to the person that has COPD. Maybe the hospital should be reimbursed for having that same therapist spend time and teach that patient so that they don't have to come back, instead of just penalizing them for coming back, penalizing the hospital. So there's a lot of barriers to what we do. There's a lot of myths to what we do. You know, we've been shown to be cost-effective, but historically reimbursed really poorly. We would love to see that change. We would think that any New Yorker should have the right to seek out chiropractic care without interference. You know, I shouldn't have to have a patient call my office and say, hey, Dr. Ludwig, do you take Medicaid? And my answer is, Medicaid doesn't take chiropractic. I get this call all the time. It's not you're saying, hey, how do we get physicians to get into Medicare? That question was asked. Okay? Here, we can't even get in if we want to. So all these people are not being taken care of. Or, they're paying cash, which is usually more than what they can take care of. So there are a few things that can improve our health and actually change our genetic potential. We know that if we exercise, certain genes are expressed and certain genes are no longer expressed. We know that if we change how we eat, the same thing happens. We also know that when your nervous system has an interference to it, from your brain to a certain organ, that those genes are affected and expressed differently. So when I do a chiropractic adjustment on somebody, it is not to relieve pain. It is allow them to be healthier on the inside. Over time, things heal, get better. Tissue damage starts to go away. That is a time factor. So I would like to ask the members of this joint committee just to recognize the proven cost benefits and effectiveness of chiropractic care. Please acknowledge this historic, unjustified bias against chiropractic in our state workers' compensation system, in our Medicaid system, and in our health care system. As we're contemplating a new fee schedule, as you're thinking about that, I ask you to remind the Workers' Compensation Board to be true to their mandate to protect the injured worker by recognizing their right to seek out appropriate quality health care in a system that respects both patients and all health care providers. When healthy people stay healthy, or when sick people become healthy, they need less drugs, they need less surgery, costs less money. I don't have a timer, so I don't know how long it took.
There's not a timer, Mike?
It's not counting down.
Not counting down. Do you sleep over there at the switch? No? All right.
Yes, you're done.
Okay. No, but thank you very much, and you should know that there's now a chiropractor as a member of the Senate, so you might want to talk to him.
Yeah, Terrence
He'll
Murphy.
definitely understand what you're saying.
Yep.
Anyone else? Thank you very much.
Thank you.
Doctor.